Hey guys, Dave the Onstation here. I'm going to go over my medical kit that I carry in my car. This happens to come from North American Rescue. I got it as a complete kit. These are kind of expensive, but they are a little bit more advanced, and you can be a little bit more prepared for major injuries. If you come up on a car crash, if you're out and about and something happens, or if you are in a car accident yourself and need to treat yourself or your passengers. Now, most people carry a really basic first aid kit that's got some band-aids and some Neosporin or something in there, and those are all fine and dandy. Something's better than nothing. But this kit right here was designed to treat a lot more patients and treat them, for kind of more life-threatening injuries. The reason I purchased this was because I wanted to be a little bit more prepared in the event that I am out alone by myself, or if I have passengers, or if I roll up on like an active shooter scenario or something. I have a little bit of supplies in my vehicle at all times that I could go out and help if I needed to. Now, first thing I want to talk about, again, is this is not a how-to video or an instructional video by any means. And there are some pros and cons to purchasing this kit as it comes. But overall, I've added a few things, I've taken a few things out just to suit my needs the best, and practicing at my level of care. So it comes in this nice heavy-duty nylon bag. You can get a few different colors in there. This one just happens to be in black. First things first, you got a set of trauma shears on the outside. Super nice. If you saw one of my other videos, this is one of the versions that has an oxygen tank wrench in there as well. It's got a nice little sheath in there. They're not going anywhere. And them being black, they're pretty well hidden. On the outside, I do carry some triage tags and a couple pens just fell down. I keep pens in here. This just allows you to do a little bit of baseline documentation in case you need to, or when you hand off care to first responders, the ambulance, your medic, etc. You can go ahead and give them this. They'll kind of know what it means. Definitely take time to fill out what you've done, what you found, and what you've done to treat it. In this outside pouch here, it comes with a few sets of gloves. They're nice and packaged pretty easily and small there. This pouch is kind of my secondary pouch. This is something that I'm going to go back to. This isn't going to be the first thing I grab. I know protecting yourself and wearing gloves and stuff is great on paper. In reality, it's going to take you a couple precious seconds to put those on before you start treating people. So, in my personal my personal choice and mindset behind it is, I'll take care of myself. I'll get shots, I'll get antibiotics, whatever, if I need to, after I take care of business. On the back side here, this pouch is designed to interface with some sort of tactical vest or on your belt line or whatever. It's kind of set up like a fanny pack or oversized fanny pack or something. But on the back here, there's a little space It's not quite a pouch, but once your bag is full, I like to put SAM splints back there. These are awesome. If you haven't heard of these are definitely a game changer when it comes to splinting. I've used these in multiple occasions, in hiking accidents, skiing accidents, etc. They're kind of a sheet metal piece covered in foam. It makes it really easy. You can bend them, and they can form to whatever you need, and you just wrap over them with an ace wrap. When we get into the inside of it, I have it kind of set up for priorities. So on the top flap here, I've got kind of my first go-to stuff, and then I've got some more trauma stuff on the inside. So I got a couple tourniquets ready to go. They're super easy to take out and apply. They just rip right away. And then I carry some tape in here too. You never know what you're going to need tape for. But on the top, I've got kind of my airway penetrating chest trauma stuff set up. So I've got a few different occlusive dressings. These ones are just some basic petroleum gauze. They work awesome. They adhere pretty well. The only problem with these is if you don't, you can't really secure them down, so you just place them over the chest wound and then they kind of sit there. And they're kind of easy to slide off or pull off or whatever, so you got to make sure you package up your patient pretty well. If I use those, I've got Hyphen Chest Seal. These are, again, made by North American Rescue. These things are super, super awesome. They're really sticky. They're not going anywhere once you put them on. You don't have to worry about them kind of sliding around like the petroleum gauze. And these are awesome. It comes with 2 of them in here. I'm not going to open up anything. They're just kind of, you know, I need to use this for real life, so I'm not going to open up packaging. I want to save everything if I can. On the top, I carry 2 needle decompression needles. These, again, are used for some penetrating chest trauma or tension pneumothoraxes. And you can use these, or you can treat these tension pneumothorax with these needles. They're, again, sealed. I'm not going to seal them, but they're basically just a giant IV catheter with a needle that you're going to insert into the chest if you recognize the signs and symptoms of a tension pneumothorax. I do carry some Narcan on here. These days, you never know what you're going to see or where you're going to see it. You know, I was at work the other day, and I just, you know, we went to McDonald's to go get some lunch, and, you know, somebody flagged us down in the parking lot saying this guy's been asleep in his car for a little bit. And lo and behold, yep, he was on a opiate overdose. Narcan's an amazing drug. You're not going to find too many issues with it as far as, you know, adverse, you know, interactions with other drugs or allergies to it. It's a super safe drug to use. It's going to reverse an opiate overdose, you know, almost immediately. And if it's not an opiate overdose, you're not going to hurt the patient by giving it. Now, moving on, I've got some nasal airways. Nasal airways are awesome. I don't know why we use oral airways anymore, because these you don't have to worry about running the risk of vomiting or stimulating a gag reflex. I'll do a video later on how to insert these. These are, you know, Good Samaritan level, practice of care, first responder level, whatever. Basically, it opens up that airway and maintains that airway. If you go through your medical assessment, airway is definitely one of the top priorities. I do also carry in here a bag valve mask. They're got a couple different names, Ambu bags, BVMs, whatever. This one is set up as, you know, with a simple face mask, and then it's got some tubing in there to be able to attach to an oxygen tank should you need it or should you have it. Super simple. It takes up quite a bit of space, but North American Rescue's got them packaged down, you know, about as small as you could possibly get it. So good on them for that. And then once you get in here, these are basically all just trauma bandages. So these are essentially ACE wraps with a sterile pad on the inside that you just wrap around, and it applies pressure to it. I've got 4 of those in here. You know, there's some nice bands on the inside. Like I said, I carry 4 of them. They're nothing super special. And then I carry some compressed gauze as well. So compressed gauze can be used to treat, you know, deep wounds that you need to pack a little bit. They can be repurposed for, you know, wrapping head wounds. They can be used for just about anything, tying stuff down if you need to. I carry 4 of those as well. And then last but not least, I've got a abdominal pad. So as far as a trauma standpoint goes, you should be able to take care of, you know, life-threatening injuries in here. I do carry another small, you know, pack of Band-Aids and some more tape and a couple of Sharpies and stuff up in my glove box in my car. With that being said, this is an awesome kit. Some downsides to it are that the packaging is really similar. So I know North American Rescue, you know, they brand all their own stuff. And they make all their own stuff, but, you know, if you are pulling from a bag and you just see the tops of these, you might not be able to tell which one's which, especially in the heat of the moment. So I wish they would color code some of their products. It would just aid in, you know, making sure you grab the right equipment. But past that, it all kind of comes down to training too. So, if you know where your equipment is set up, I know all my trauma dressings are over here, my compressed gauze are over here, I've got my ambu bag and my, whatever. It kind of, you got to know your equipment a little bit, but if I just toss my bag to somebody else, they might get a little bit confused. The other thing is, this bag has a few different purposes in mind as far as how you carry it. This could be attached to the bottom of a backpack. This can be interfaced with body armor, or it can be worn as a fanny pack style kit. Now, I wish they'd kind of pick one or the other, or allow you to purchase separate bags or setups appropriately. Now, that's kind of me just being a little bit picky, but I think that definitely has a place, right? I don't need all these extra straps hanging off. They could get snagged up on something if I'm trying to wear it as a fanny pack, or if I'm trying to get in and out of vehicles, whatever, if I'm wearing this. This, however, for me, is just dedicated to my vehicle. I just clip it on the back, via the waist strap here. Past that, that's pretty simple. I am able to treat, probably 2 or 3 people out of this, no problem, before I'd really have to, start thinking outside the box. And, if I'm in a situation where I need to do that, I better start praying that, first responders are on the way. And this kind of boils down to what your comfort level is and what your skill abilities are. So, for me, this is something that I've definitely, thought the investment through and thought the application through. I'm comfortable with using all of the equipment inside of here. If you are, if you're not, that's up to you, and you kind of got to tailor your medical kit to your specific needs. Okay guys, that was a pretty brief overview of the medical kit that I carry in my vehicle. I think it's definitely something you guys should all consider. It's, you're never going to be too far away from your car. Notice that I didn't have anything in here that I'd have to worry about freezing or whatever. I might, in the summer months, I might be able to add or get away with adding like an IV bag in there. However, the real application to that's kind of up in the air. I'd rather have it not need it than need it not have it. That's just my personal opinion. But then you got to start worrying about when your IV bag expires, when if it's warm enough, if it's if you got to worry about it getting punctured, etc. But past that, I think this is a really good kit to buy. North American Rescue makes some great gear. I'd love to get some more products from them to do reviews on and test out. If you thought this video was helpful, don't forget to like, comment, subscribe, and we'll see you next time. Thank you very much.